All right, we're going to go ahead and get started in earnest. I think we are good to go. Again, Dr. Green here with the Autoimmune Matrix webinar. I'll give you guys just a little bit of background on myself. Once again, I am a chiropractic physician, but I've got some unique training, and I really, over the past 10 years, I've dedicated my professional and personal life towards becoming a better and better doctor. What that means is I have gone back to school and I've continued to learn. I am fellowship trained in integrative cancer therapy. It's through an organization associated with the University of South Florida Medical School. I am board certified and I have a diplomate in anti-aging medicine through the American Board of Anti-Aging Health Professionals. I am a certified functional medicine practitioner, board certified in integrative medicine, and I am certified and training in functional neurology. I'm a certified gluten practitioner, and I am currently enrolled in Dr. Daniel Amen's Brain MD, Brain Health University, clinical functional neurology program for physicians. Again, bottom line, my goal in my training is to be the best doctor that I can. How can I help you better? How can I become a better professional? You know, we are here to talk about autoimmune disease. And what that means, well, we got to talk about what we call the triangle of health. So imagine health expressed as a triangle. At the base is your genes, all 23,000 of them. Each of these are inherited by your parents, and you have them your whole life, but they're not always noticed until other factors activate them. You know, we're born with our genes, but they don't turn on necessarily until something goes wrong. In fact, the genes can be turned on and off like a light switch by what we can visualize as the points on the health triangle. We're going to call these the chemical point, the physical point, and the mental point. And, you know, it'll make more sense as we kind of discuss these components of your health, but, know that what we're looking for here is a triage, and you got to look at, as functional health doctors, the whole triangle in its entirety. So this triangle of health is what we call the autoimmune matrix, and it represents components. And we understand that autoimmune disease they're caused by chemicals. They're caused by physical or mental influences that turn on certain genes. In other words, autoimmunity is bred by lifestyle choices and behavior. It's also important to note that each of these elements can interact with one another. For example, if we're not tending to our physical self, our chemical self reacts and vice versa. Fortunately, this means that it can also be addressed in the same way. Our influences, chemically, physically, or mentally, can determine our health to be either compromised or optimized. While this may sound scary, it is actually quite empowering, and it can instill a lot of hope in people, those suffering from autoimmune diseases. I had a patient this morning that I spoke with who indicated a lot of emotional stressors that they had worked through, and we saw a breakthrough in significant chronic pain that was no longer there as a result of improving the emotional component. Once again, this triangle really does work. And most conventional doctors today, they only focus on the chemical component using medication. And there are endless ways to influence the body using the standard of care, artificially manipulating inflammation, vital hormones that you can manage, many of the other essential chemical processes within the body. And it's all done with one common goal. And we know what this goal is. It's covering up symptoms. On the other hand, a clinic and a functional medicine practitioner such as myself, we address what we call the root causes, the origins of disease. And we want to ensure comprehensive and effective treatment is given to the patients. It's not just patch care, not just covering up symptoms. It's fixing the underlying problems once we identify what they truly are. You should never consider covering up symptoms as a cure. It's not, and it's disguised as one so many times. Oh, you take this medication, you're cured. That's not life. That's not reality, because you stop taking that medication. Ask yourself, what happens if I don't take this treatment? It hasn't fixed the problem. Now, in a functional approach, we talk about functional medicine. Functional medicine is centered around the patient versus the disease. In practitioners, we see health problems as a reaction to dysfunctions within the body rather than as an isolated issue. This approach is truly revolutionizing the medical field. It empowers patients to better understand imbalances in their bodies, how these imbalances affect their health, and the solutions available to support the normal healing mechanisms within their body. When it's applied to autoimmune conditions, people are astonished by the improvement in their health, if not completely recovery. And you know, I got some flack, I think, by some people on Facebook when we were advertising for this webinar. Some of the myths of autoimmune disease. And I know a number of people, they say, hey, you can't cure autoimmune disease, and there's no complete reversal. And I don't always agree with that. I think that there are ways to get the body into homeostasis to help correct imbalances. I think the research is really clear that there are clear causes for certain autoimmune diseases, certain infections and toxins that contribute to diseases. When you remove those infections, you see improvements in those disorders. And you know, whether the patient completely reverses or cures their disease or recovers to a point where they are asymptomatic for the rest of their life may be debatable, but the end result is we're looking for a better outcome. So we're looking for longer lasting outcomes. Now, you know, how many of you have seen doctors who've told you that nothing is wrong with you? You go to the doctor, they run labs on you. They say, I don't see anything. Your labs are all normal. I'll see you in 3 months. I'll see you in 6 months. You know, we'll come back for your next checkup. We'll check it again, but there's nothing that we're dealing with. And, you know, you have these symptoms, you're hurting. And this is besides the fact that you have complaints that you're sharing with them. And they just say, we don't have anything wrong. Some of you may be on thyroid medication. How many of you have had your medication levels changed over and over again? The doctor may say your TSH is high, your TSH is low. It's a thyroid test. And they may put you on a hormone and raise it or lower it. It's what we call a hormone roller coaster, instead of fixing the causes of your problems. And you know, nobody wants to be on that hormone roller coaster. It's not, gosh, that's not a good outcome long term. You never get better staying on the roller coaster. Now, why can't the doctors fix us? Why are you here listening to us talk about autoimmune disease, me talk about autoimmune disease in the Autoimmune Matrix? When you go to your doctor, when you go to the doctor is trained to be the person that gets us well. We've always been told that. But they simply aren't trained in helping fix the type of chronic health problems that we're seeing in America today. Most chronic health issues are autoimmune diseases. We know conventional healthcare has very little to offer besides steroids for these patients. Conventional and alternative healthcare does not fully understand autoimmunity. Much of it leads to tissue destruction. So when we talk about an autoimmune disease, our immune system is mistakenly attacking healthy tissue in our bodies. It's making what we call autoantibodies against self. Your immune system thinks that a part of your body is an infection and it's trying to remove or kill itself. You think about this. Can you name 5 autoimmune diseases? No, gosh, autoimmune disease, Hashimoto's, autoimmune thyroid disease, multiple sclerosis, rheumatoid, fibromyalgia, chronic fatigue syndrome, lupus, Lyme disease, osteoporosis, mixed connective tissue disorder. The list goes on. And really, the list of disorders that medicine has failed you, it cannot treat you properly. It gets bigger and bigger every day. So in an autoimmune disease, when the body attacks itself, we're going to talk a very simplistic, but I think important concept. You have 2 sides to your immune system. Th1, which is your soldiers, okay? And it's this Th1 system, T helper 1, that helps your body fight infections. And then Th2, which is antibody producers, the ability to identify and target good and bad tissues in the body, or enemies, if you will. And when we have a healthy balance, then your body is healthy. If you get sick, a normal healthy person gets sick, they have a shift, fights the infection, it calms down. In an autoimmune disease, it shifts, but it stays shifted. It goes, it's like you're shooting for the stars. You're never seeing an improvement, and it continues to be aggravated. It does not get better. And this is important because that imbalance in your immune system drives the symptoms that you're dealing with. In fact, the more out of balance that your immune system is with Th1 or Th2, the more tissue destruction that you're going to have. Now, what causes the immune system to go out of balance is really the key for this webinar. That's what we're talking about, your autoimmune matrix, right? So what would trigger your immune system to attack? Dysregulation, so chronic inflammation from poor diet. We're talking essential fatty acids, bad blood sugar, adrenal gland dysfunction, hormonal imbalances, neurological imbalances, thyroid, vitamin D, chronic infections, bacterial, viral, or mold, infections in the gut, food sensitivities, environmental toxins, or leaky gut syndrome. We know proper testing helps us identify and find out why this is happening. So why is this there? Well, like we said, the more out of balance your immune system is, the more tissue destruction you're going to have. So how many of you have had a discussion with your doctor about what your immune system has done to your body and where your health problems are coming from? Why haven't you had that discussion? You deserve to understand your condition. You deserve to be able to correct the imbalances in your condition. Now, it is my belief that the overwhelming majority of physicians don't continue to learn and read research once they start practicing. There's simply no time in our modern insurance-mandated world to read medical journals and continue with postgraduate diplomates, board certifications, and fellowships beyond where they're practicing. It's just not how practice works. You go through a fellowship, you go through certification, and then you go out and you practice. And some of these doctors, they don't want to continue doing that. So they rely on what they learned in school. And that could be 15, 20, 30 years ago. And in many times, when we're talking about autoimmune disease, it's outdated information. So I think big picture, the only thing that matters with you, with your health, is results. And you're not getting any. That's all that matters. The reason you guys go to the doctors that you're going to really may not be because they're good. They're not getting you better. That's why you're here. It's because insurance tells you to go to them. It's because insurance covers them. So, like I said, you're not getting the care you want because your doctor isn't looking in the right places to fix you. One thing you need to know, if you want to write this down, you can. Every single one of you is suffering from the same problem. That's what we call a web of physiological dysfunction. None of you on here have just one problem. Physiologically, it's an impossibility. What I mean by web of dysfunction, all of these issues are going on at once. You've got all these problems right here. You've got blood sugar imbalances, adrenal imbalances, gut imbalances. You have thyroid dysfunction, hormone imbalances, liver issues, immune system dysfunction, brain neurotransmitters, cellular dysfunction. All these things are going on at once. And these problems, gosh, it looks confusing, and it can be. Many doctors give up. They pass the buck to the next specialist. So if we don't address specific problems in your web, you're never going to fix your chronic autoimmune health problems. So we're going to talk about a few of those problems. Thyroid is a big issue. Now, if you have a bad thyroid, you have a bad brain, you have a bad gut. It's interesting because hypothyroidism is one of the most common autoimmune drivers or diseases that people deal with. In fact, 90% of hypothyroidism is due to autoimmune disease, and it's a really common autoimmune problem that we see in our clinic, and it's the most common autoimmune disease that affects women. In fact, your thyroid literally affects everything in your body. If we talk about symptoms associated with your thyroid disease, gosh, fatigue, weight gain even on a low-calorie diet, morning headaches that wear off as the day goes on, depression, anxiety, brain fog, constipation. How about stomach aches, gas, bloating, reflux, IBS, all these GI symptoms, cold weather sensitivity, poor circulation. You get sleep, you wake up, you go right back to bed. No matter how much sleep you get, you're still exhausted, severe fatigue. Itchy, dry skin, dry, brittle hair, and hair loss, especially the lateral 1/3 of the eyebrows. So every cell in your body has thyroid receptors. It is that common. So the thyroid's pretty important. It really is. Now, don't forget about the adrenals. The adrenal glands, two little glands that sit on top of your kidneys, and they release cortisol and other hormones in response to stress. So the adrenals set your sleep cycle. If you have sleep problems and you have not been tested for adrenal fatigue, you need to have an adrenal cortisol panel done. It's done in either saliva or urine, and it's 4 to 5 samples over 2 days to measure what your adrenal cortisol and cortisone levels are doing to set that circadian or sleep cycle. The adrenals help blood sugar. The adrenals affect other hormones. We have great success in our clinic with infertility. Our infertility patients really have seen success in large part because we've been able to balance out autoimmunity, gut dysfunction, thyroid, and adrenal dysfunction. Now, the adrenals impact testosterone, estrogen, DHEA, progesterone, and DHT. And in fact, there's a direct correlation between the adrenals and your brain. A brain function, cortisol destroys your brain when abnormal. If you've ever been really late, for work or for a meeting or for an event, and you're running, trying to hurry and get everything ready, and you can't find something, you lose something. You always have difficulty. Memory goes out the window when you're stressed. Adrenal symptoms could actually be thyroid symptoms as well, and they could really be sex hormone symptoms. It's all related. In fact, hair loss, fatigue, sleep problems, and hot flashes are a very common symptom that I'll see. You can say, hey, that sounds like menopause. It could be thyroid disease or adrenal fatigue. You have to check all three conditions. And we're all at risk for adrenal dysfunction. You know, the stressors that we have in our society are so prevalent in this day and age. How about sex hormones? Male hormones, we check for hormonal imbalances that can associate with andropause or low testosterone, prostate disease in females, infertility, menstrual cycle problems, or menopause. Why do we get hormonal imbalances? Blood sugar involvement, adrenal involvement, thyroid involvement, brain involvement, and involvement in one hormone affecting the other through something called the HP axis, the hypothalamus pituitary axis. How about unstable blood sugar? So that's a big one as well. We know that sugar is very important for us. And you really want optimal blood sugar 75 to 85. The lab says 99 is healthy. The reality is that's really not healthy. That's too high, because 100, you're pre-diabetic. So how does the body know 99 is healthy, but 100 isn't? Yeah, I don't think that works that way. If blood sugar gets too low, it'll kill nerves as well. Where? In the brain and the extremities. In fact, neuropathy is something that we see a good bit of in the clinic, and it's something that we have to address effectively if we're going to get your body better. Anemia would be the next topic that we look at that we have to address. Now, anemia is caused by vitamin or mineral deficiencies. So we're going to talk about deficiencies in a second. It's caused by infections in the gut, blood loss, menstruation, colon problems, if you have IBS, IBD, if you have ulcerative colitis, stomach problems, trauma, autoimmune diseases. There's a disease called pernicious anemia that we test on our patients. It's an autoimmune attack against a part of the body responsible for making vitamin B12. That's really important, especially if you have fatigue or nerve issues. How about chronic infections? So a very common form of anemia, it impacts red blood cells, it impacts iron ferritin levels, stored iron levels, if you have inflammation or infections. And of course, malignancy, cancer, pathology can also contribute. Now, when we talk about nutrients, I'm going to quote Dr. Peter Osborne. The importance of nutrition can't be argued. It's absolutely critical. And there are certain deficiencies that I think we see a lot of. Essential nutrients found in foods, like vitamins, minerals, amino acids, carbohydrates, and fats, they're necessary for the proper functioning of the body. Each have their own job, and everyone's needs are specific to their own unique health. One thing to consider is the why behind these deficiencies. Classic problem we see, vitamin D deficiency. Could be due to not consuming foods that contain them, could be due to impaired gut function, or the result of an existing autoimmune disease. But what I hear all the time is a patient goes on the vitamin D, for example. Their doctor says your D levels are low, take it. 3 months later, your D levels are now within range. So they went from 25 to 35, when the range is 30 to 100, and optimal is probably 80 plus for that patient. But they're at 35, and the doctor says they're now within range, you can stop taking the vitamin. So the patient stops taking the vitamin, and you know what happens? The D levels drop right back down again because the problem wasn't fixed. Why are the levels low? So the most common ones that we see, vitamin D, vitamin B12, folic acid, that's B9, zinc, omega-3 fatty acids, and believe it or not, dehydration, water. That's huge. Now, unfortunately, the commonplace procedure of measuring these levels is blood testing, serum testing. And it can be very limiting because they don't take into account the fluctuations of vitamin content throughout the day or around meals. That being said, serum lab testing is not a good indicator of the storage of nutrients, the sustained nutrient levels, or accurate deficiencies after digestion. It's an important conversation to have with your doctor if that's the only test being offered to you. There are micronutrient tests that you can run. We'll talk about some of the tests later on in this lecture. But let's look at a few of the deficiencies. I think there's some that are really worth addressing. Now, vitamin D, I want to talk about this one specifically. It's so important. Most immune cells have specific vitamin D receptors. They help modulate the immune activity and response. It's no surprise that clear connections have been found between autoimmune diseases and this deficiency. In fact, a few of the more prominent ones, type 1 diabetes, rheumatoid arthritis, and multiple sclerosis, all associated with low vitamin D levels. There's two forms of vitamin D, 25-OH and 125-2-OH. It'll be interesting to say if it's 125-2-OH is elevated, I see that very commonly in pathologies, including cancers. Some common foods are high in vitamin D. So wild-caught salmon, tuna, eggs, mushrooms, or fortified cereals, they have good forms of vitamin D. You can supplement with those foods, but the most abundant source of vitamin D is going to be from direct sunlight. Yet we're advised to limit our time in the sun and wear UV blocking protectants. So we're told don't get vitamin D from the sun, obviously because of the risk of skin cancer. Now, vitamin D is immunomodulatory. What that means is it aids in proper immune system function. This in turn helps to prevent autoimmune disorders. That doesn't add up then. So if we need vitamin D to help autoimmune disease, why don't we get vitamin D? And it's actually, I'll take it a step further. Like I said, the majority of patients who have autoimmune disease have D3 levels which are very low, oftentimes below 30 or even 20 on a blood test, with optimal levels oftentimes 80 plus. I see a number of my patients that should have levels 80 to 100 for the optimal range because their body doesn't use the D as effectively as it should. There was a great study at the University of Michigan that compared vitamin D supplementation, D3 supplementation, versus metformin medication for type 2 diabetics. And these were insulin-resistant diabetics who were not currently on insulin. What they found was proper dosing of D3 supplementation had improved outcomes of 60% improved insulin regulation or insulin resistance versus only 40% improved insulin resistance for the metformin patient. That's huge. That means the right vitamin deficiency does a better job of fixing disease than medication. And that's what we want to talk about. How can we naturally treat our patients? So medications and deficiencies we do have to address. I mean, it's important. Some common medications used to treat autoimmune diseases, they can actually cause vitamin and mineral deficiencies, and that can actually hinder the immune system. You can see how that's counterproductive. So you deserve to know if the medication you've been prescribed causes deficiencies. And if so, you need to be given the appropriate supplementation to offset that. I've got a couple of references for you. I'm just going to fly through these. Blood pressure medications. You often see a B1, B6, vitamin C, magnesium, calcium, potassium, zinc, sodium, CoQ10, and melatonin deficiency. I will have this list posted on Facebook this evening so you can reference and see what deficiencies are common. For cholesterol medications, the following deficiencies may occur: vitamins A, B2, B6, B12, D, E, K, folic acid, that's B9, beta-carotene, iron, and CoQ10. For common diabetes medications, B12, folic acid, and CoQ10 deficiencies are common. For anti-inflammatory medications, vitamins A, C, D, B12, folic acid, potassium, iron, magnesium, and zinc deficiencies are common. For heartburn medications, vitamin D, B12, folic acid, beta-carotene, calcium, iron, and zinc deficiency. And for hormone replacement medication, B2, B5, B6, B12, C, folic acid, magnesium, zinc, and selenium deficiencies. Now, these don't go for all medications, but they're general guidelines. And, you know, I think the bottom line here, it's always most important to have the proper testing to ensure you're treating your unique condition. So I think we need to talk about gut function a little bit. You know, I think this is huge. Even Hippocrates, the father of medicine, said, look to the gut, you'll find the origin of almost all human illness. And when we talk about the gut, it's the gateway to health. 80% of your immune system, up to 80% of your immune system is in your gut. In order to properly diagnose nutrient deficiencies or most health complications in general, it's important to rule out any issues associated with gut dysfunction. If your gut is not functioning properly, it's unlikely that your body will be able to absorb the proper nutrients. So eating the right foods or taking supplements can go unnoticed, and you may become frustrated with lack of improvements. So major functions of the gut, obviously digestion, immune response, nutrient absorption, hormone regulation, vitamin production, detoxification, mood management. I had a patient this morning who said they ate something the other day and they think that it was dairy that they were reactive to, they were sensitive to. And literally within minutes, they got fatigued and they had severe just irritability. She said she got angry to her husband. And she didn't know why. There was no reason, and really felt it was from the food that she'd eaten. But, above all, I think that it's important to understand the gastrointestinal tract's sole purpose is to ensure that you're absorbing the good and excreting the bad. If this balance is disrupted, major health complications will occur. Now, there's 10 times the amount of bacteria in our body than our own cells, and the majority of these bacteria are housed within our digestive system. Being said, gut health is truly the gateway to health for a number of reasons. Now, our gut does have defenses. We call them firewalls to help it do its job. They include something called GALT, or gastro-associated lymphoid tissue. It's the gut's immune system. And in fact, 70% of our immune system, like I said, is based here. Something called tight junctions. They're small proteins that are responsible for holding the gut cells together. Mucosal IgA, it's also known as immunoglobulin A, and it's the antibody considered our first line of defense against toxins. How about friendly bacteria? As we mentioned, we have more bacteria in our bodies than we do in our own cells. The bacteria can communicate with the gut, warning it of potential danger. Stomach acid, it's absolutely essential for the digestion and absorption of nutrients. All of these barriers together combine to promote a healthy gut and in turn, healthy immunity. So how does the gut get leaky? How do we get these damages? Well, leaky gut is when the tight junctions between the intestinal cells open up due to the proteins breaking down because they're aggravated or agitated. When it happens, bacteria, chemicals, and toxins can leak out of the digestive tract and eventually enter the bloodstream. This signals a flood of immune antibodies, an increased allergic reaction, and that cycle continues and ultimately will lead to autoimmunity. So we need to know what is specifically irritating your gut. So we're going to talk about the common culprits. I believe this list is a really good list of what causes gut dysfunction. Abnormal levels of healthy bacteria. Stomach acid imbalances. We need stomach acid. We don't have high stomach acid. Most people have low stomach acid as we get older. Leaky gut syndrome. Food sensitivities, we'll talk more about those. Gut infections and medications. Now, medications can damage our gut, and it's important if we're on medications to be aware of potential risks. Antibiotics can destroy the good bacteria needed for digestion. They can cripple vitamin synthesis and increase your risk of yeast overgrowth. Common pain medications have been found to erode the mucosal lining of the stomach and small intestine, which can lead to leaky gut, intestinal permeability. Acid reflux medications block stomach acid production. In turn, it hinders digestion and absorption, which leads to nutrient deficiencies. Antidepressants negatively affect the neurotransmitters in the gut. Gluten is huge. So food sensitivities, right? Gluten was the first medically proven cause of autoimmunity in 1952 by Dr. William Dick. And since then, plenty of research has backed up what he's found. Now, gluten allergies and sensitivities are so common, and increasingly becoming more common. And we know recent research has been implying that gluten can even cause adverse health effects in people that don't have these conditions. So why is this happening? Well, gluten produces a protein. This protein is called zonulin. The zonulin directly affects the lining of the intestinal lining. Well, that's going to be leaky gut. And then the antibodies that are produced to attack are basically going to leach out of the GI tract and into the bloodstream. And the body reacts by secreting inflammatory chemicals as a defense mechanism. But what happens is it doesn't differentiate between gluten, which is the invader, and the body's healthy tissue. So it starts attacking your tissues, like your thyroid, your cerebellum, your gut lining, and that's what we call autoimmunity. Now, the most sensitive food sensitivity is gluten, and we do show that a gluten-free diet is a must for any autoimmune disease. But there's many other foods as well: dairy, oats, rice, corn, eggs, chocolate, coffee. There's a huge list of foods. I look at over 96 foods in my clinic that can be potentially causing immune reactivity in your body. And we do know that there's a lot of ignored allergies. So food allergies, medication allergies, surgical allergies, chemical allergies, mold allergies, and allergies in the additives in any of these above lists. And if it's untreated, allergies can cause serious health complications, including autoimmune disease. But we know we can test for them, right? Skin tests, blood tests, lung function tests, patch testing, food challenges like elimination diets. The most common form of testing used in my clinic is blood testing through specialized labs such as Vibrant Wellness and Cyrex testing. These tests look at immunoglobulins, which are those immune system soldiers, those building blocks. And I look at immunoglobulin A and G, and they allow us to know what foods your immune system is actually reactive against. Infections, H. pylori, Klebsiella, E. coli. We see a large number of Lyme patients in our clinic in North Carolina. Parasites from sushi, swimming in lakes, traveling, Candida, Saccharomyces, mold. What about heavy metals, lead, mercury, cadmium, arsenic, fluoride, bromide, and chlorine? And they're all dangerous to our health and immunity. Unfortunately, we're exposed to so many of these in the air we breathe, the water that we drink, even the food we eat. So the most alarming way that toxins affect our health is actually by competing with minerals for binding sites. So what that means is you may have fluoride come in, and it will knock iodine out of the way, so now your thyroid doesn't work. And that leads to deficiencies regardless of your daily intake. Your exposure to many of these toxins is often gradual, and therefore the accumulation can be left unnoticed for extended periods of time. Remember your web of physiological dysfunction. We have to address all these pieces of the puzzle if we're going to get you well. Now, many of you go and you've had lab tests done, and the doctor said nothing's wrong with you, but you feel lousy. So for many of you, they're not running the right tests. And they don't run nearly a comprehensive enough panel. They will run 1 or 2 thyroid tests when you should run 9. Or they use traditional lab ranges. Now I use LabCorp for most of my blood work. We use Quest as well. These are national labs. And the lab range that I get back is this big reference range. And it's based on unhealthy people. So functional lab values are more sensitive to reveal problems that show up. And we use narrower ranges. They are more sensitive. So if you have this lab range, this high-low, if you're low, there's a problem. If you're high, you're a problem. You're out of the range. But just because you're in the range doesn't mean you're healthy. You need to be in the functional range. So for like TSH, for example, the functional range is 1 to 2.5. The lab range is 0.4 to 4.5. So if you're at 3, 3.5, you are hypothyroid. Something is wrong, but it's going to be missed by the medical doctors or by the traditional system. In my office, what we do is we fix chronic metabolic problems. That's our specialty. And I practice what we call a neurometabolic model of treating these patients. And the way we do that is different than the medical approach. It's not going to prescribe steroids. It's not going to give you hormone replacement in most cases. It's not removing organs that have become diseased. It's not symptom management. What we do is we address the underlying metabolic causes. Examples with the thyroid: take Synthroid, take Armour, chase your TSH hormone levels, more medication, less medication, instead of fixing the cause of your problem, which is most likely autoimmune Hashimoto's. We don't prescribe antibiotics. We don't give acid reflux medication. We fix the cause of the problem. With brain problems, anxiety medications, SSRIs, depression, they don't fix the problem. Excitotoxins like GMO ingredients, genetically modified ingredients, glyphosate, MSG, aspartame, they contribute to brain dysfunction. In a functional medicine approach, we remove immune triggers. Food sensitivity testing. We recommend a specific diet. I use 5 different diets that I use depending on the patient based on your individual needs. Infections are tested and assessed. Blood sugar is assessed. Adrenal function, thyroid function, sex hormone function, liver function, red blood cell function, kidney function, all assessed. With liver gallbladder problems, very, very common. Methylation, which is an issue with your B vitamins helping fight inflammation, is something we look at very closely. We do genetic testing. I love Ancestry to get data, and then a company called LiveWello to actually give me genetic data that can help me treat you better. One of the classic genes that we look at is MTHFR. Vitamin deficiencies are huge. Heavy metal toxicity, chemical toxicity. We even look at your supplements, which could be causing problems. So in a neurometabolic approach, our office, I'm going to modulate your immune system. Dietary modification, lifestyle changes, supplements based on lab findings specific to your body's needs. We really treat the root cause of your problems. We address neurological misfiring, functional neurology, brain-based therapy, PEMF therapy, neurofeedback therapy is all used in our clinic if you come into our clinic. The bottom line is we look at the whole person, not just the condition itself. With that being said, I hope you guys have enjoyed our talk. Life is always a matter of choices. If you like what you've heard, I can sit up here all day, we can preach, but it really comes down to a simple life decision. if you want to get help, if you would like me to help you, if you would like our office to help reinvent your life, you have to set an appointment. We normally do $179 for our new patient appointments. By joining us on this autoimmune webinar, it's discounted down to a $69 fee. And what that is you end up with 2 office visits with me, whether it's in office or distance virtual care. So it's both available. In-office care is ideal for chronic pain, fibromyalgia, peripheral neuropathy patients, stroke patients, cancer patients. Either option is great for autoimmune, thyroid, MS, or Lyme. So, action steps. First and foremost, give me 1 second. I've got one more. All right, we're back. All right, so like we said, you've really got options for what you do with your care, but I want to talk just a little bit about some action steps with you guys. So first and foremost, get the proper testing done to identify your body's unique needs and treat accordingly. You know, luckily, there are lots of things that you can do to amplify your health now. Some of the additional action steps that you can take to win this fight against autoimmune complications, take control of your health, try intermittent fasting. Now, that's a complex concept. I will talk more about that on Facebook, and we'll go into details. We utilize paleo, autoimmune, SCD, low FODMAP, ketogenic. We use keto paleo, a wide range of different diets with our patients depending on what the needs are. But intermittent fasting is a great concept within this. Cut out all grains, all dairy, all legumes, all nightshades, all processed foods. Change your diet to only contain easy to digest whole foods. Administer an elimination diet. Stay adequately hydrated. Make sure to eat enough fiber. Take a quality probiotic. Supplement with digestive enzymes. Avoid unnecessary antibiotics. Detoxify regularly. Practice deep breathing exercises. Adopt good hygiene behaviors. Exercise regularly. Connect with others. Be sure to sleep enough, at least 6 to 8 hours a night. Rest when you need it. Find a hobby you love. And most importantly, or last but not least, do what makes you feel happy and healthy. Thank you. I appreciate all of you watching our webinar, and thanks for being on the call with us. Just you have our phone number, 704-987-3993. Feel free to visit my website. It's www.drakibagreen.com. If you're interested in scheduling a consult with me, click the schedule today or new patient buttons and it'll get you scheduled. If you are within typically 2 to 3 hours of the clinic, I would recommend an in-office consult if you're able to. If you are farther than that, it still may be worthwhile for you to make the in-office consult, but we do offer a virtual distance program for patients. Hey, Sherry, welcome back. I thank you for watching tonight. I look forward to meeting with each of you. I will have this workshop up and we'll have it available recorded, and I'll upload it to our Facebook page hopefully in the next day or so, and you'll be able to rewatch it as well. But you know, I thank you again, and you know, happy healing. One more time, our website is drakibagreen.com, 987-3993. Both of you are unmuted. All of you guys who are here, if you wanted to ask any questions, feel free, and I'll do what I can to try to answer them. We've got a couple minutes left. All right, great, excellent, excellent. Well, I'm glad that you were all here, and look forward to hopefully meeting some of you in the office live or having Skype virtual distance care consults. Have a great day. Thank you very much. I hope this workshop was helpful for you. Take care.